Biochemical assessment of niacin. Static measurement. Biological indicators are tested in measuring niacin levels within the body, such as the following. First is the urine test. Niacin status can be measured by its two major methylated metabolites, which is the N1-methyl-nicotinamide and the N1-methyl-2-pyridone 5-carboxamide. Excretion rates of 17.5 micromole per day of these two metabolites within the adults indicate adequate niacin status, while 5.8 micromole per day below indicates niacin deficiency. When urinary excretion rates of these metabolites is less than 5.8 micromole per day, reflects inadequacy in the niacin status. Furthermore, certain indicators for inadequacy occur well before overt clinical signs of niacin deficiency. Niacin and its metabolites can be analyzed through the use of liquid chromatography and mass spectrometry. However, niacin and its metabolites are a bit challenging to test due its high in polarity. Thus, recent studies are conducted to prove the effectiveness of using supercritical fluid chromatography in evaluating niacin status. Second is the NAD levels in the blood. Niacin status can be tested through determining the NAD levels within the blood. NAD levels decline as niacin status deteriorates. Niacin number is the ratio of NAD to NADP concentrations in the blood multiplied by the 100. If the niacin number is below 130, it reflects a deficiency of vitamin B3 or niacin. Lastly, erythrocyte niacin, a sensitive, reliable, and convenient biomarker for niacin status. Assessment. The erythrocyte NADP is not affected by abnormal niacin status and is fairly constant. Moreover, niacin index is the ratio of erythrocyte NAD to NADP concentration. If niacin index lowers below 1, thus suggesting that the patient is risk of developing niacin deficiency.
So, dietary niacin deficiency and the pharmacological excesses of nicotinic acid or nicotinamide have dramatic effects on cellular NAD pools, ADP ribose metabolism, tissue function, and health. So, moving on to the functional assessment, we have transfer of adenosine diphosphoribose. So, what is ADP ribose metabolism? So, this participates in several biological processes such as DNA damage signaling and repair. So ADP ribose metabolism is providing new targets for pharmacological intervention, and it's important to consider how the supply of vitamin B3 may directly influence ADP ribosylation reactions or create interactions with other drugs designed to influence these pathways. In addition to its redox roles, NAD plus is also used as a substrate for mono, poly, and cyclic ADP ribose formation. And during niacin deficiency, not all of these processes can be maintained. And of course, dramatic changes in tissue function and clinical condition could take place. So next we have the zinc level test. So zinc plays a role in the paradox-independent metabolic interconversion of tryptophan to niacin. Its correlation with niacin deficiency is that pellagra patient, pellagra is the main condition that we acquire if we are deficient in niacin. So they have been found to have low plasma zinc levels. So they are advised to take zinc supplementation, which increases the urinary excretion of 1-methylnicotinamide and 1-methyl-2-pyridone 5-carboxamide. So next we have the red blood cell NAD levels. One of the methods for assessing niacin status in humans is the measurement of the active coenzyme of niacin, NAD, and NAD-P. So sila duha. Erythrocyte NAD and NAD concentration are more direct measures of functional niacin status and have been shown to respond to changes in niacin intake in humans. The pyridine levels in whole blood, this includes the plasma, the red blood cell, the white blood cell, the platelets, or in erythrocytes as a whole, they have been measured in pelag patients and subjects that are fed with low niacin levels of diet. So some investigators reported decreased levels of erythrocyte pyridine platelets in pelagrins. So it's just the other term for people with pellagra. Pero in one study, it has been known that the levels of whole blood pyridine platelets were decreased almost 40% in human subjects that are fed with an experimental diet low in niacin and tryptophan.